Hey, it's time for our weekly visit with our good friend Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. And Joe, I'm sure you're going to go down the road for us with Jarrett Allen. Broken finger, they say out indefinitely. I haven't seen anything on this. Of course, this is in your arena of a sports medicine. I guess go down this road. Jarrett Allen, what have you heard?
Well, Ray, the Cavaliers finally get rewarded for having a good season, being on national TV. So a lot of eyes were on the TV set Sunday night, and the little confusion, and this happens sometimes with the injury with Jarrett Allen. At first the sideline reporter said, "Oh my gosh, he had a cut on his shoulder. They were just going to clean it up." And then they said he had a quad contusion and he is out for the game. And then the next day we read that he has a finger fracture. And sometimes we will work for 24 to 48 hours to put the timeline together. I know I have to do this in the high school setting, and I have a couple right now, teams that are still alive in the playoffs. These coaches need to know, and coaching staffs and parents and trainers, what's the timeline for return? And the timeline for return on Jarrett Allen's finger is indefinite. They're saying they don't know for sure. That's not a good sign. And that probably tells me that it's probably an unstable fracture that they may be contemplating whether he needs to have it operated on, and it may be some time for Jarrett Allen to be out. But it did bring up for me a more common injury. The second of the 3-for-1 injuries was the quad contusion. And, with you, I haven't spoken with the audience in a long time, and there's a lot of confusion and mismanagement of this injury. And so I do want to go down that road. I know that one well. And it's one that kind of mismanagement, or people don't really understand what to do with it. Athletes, trainers, even coaches, parents. And so I wanted to just touch on it a little bit today. So quad contusions are really common, of course. They're very painful. People that have played contact sports, kind of almost everybody's had even a mild one. But more significant ones can put even the best of athletes out. Steph Curry had one earlier this year. He missed over a week of time. So I want to talk to people just about managing it just briefly. So this happens generally to the thigh with a need of getting kneed in the thigh, but you can be on the ground getting kicked in the thigh or a helmet to the thigh. It actually occurs in basketball and soccer more than football because football players wear a thigh pad that is meant specifically to prevent this injury. For a while, there was a lot of talk going around about soccer players considering wearing thigh pads to try to reduce this, because this is very common in soccer, but that never came to pass. But what happens is when you get kicked or kneed hard in the thigh, there's a lot of blood vessels, and we get, with a hard contusion, a lot of broken blood vessels, and a thing called a hematoma, and that's a blood collection in the muscle. And with it being one of the biggest muscles, the blood can just stay there for a long period of time, and the kids kind of complain about, oh my gosh, there's a lot of pain. It's really painful if I bend it or move it. And so what we do a lot of times is we immobilize it. Immobilizing it is absolutely the worst thing you can do with a quad contusion and a hematoma. And so we actually feed into it medically sometimes. I see people who went to an urgent care or somewhere else, maybe where they will be placed in an immobilizer and put on crutches and told not to use it at all. And in fact, what happens if that blood stays in the same spot for a period of time? After a few days, it kind of becomes kind of rubbery and whatever. Against the bone, though, what happens at 10 to 14 days is it can harden. It's a very oddity, but actually it'll calcify. When we get x-rays at 2 weeks, 3 weeks, or later of people that are sent to us, and they say, I can't bend it at all now. And you can see bone sitting in the muscle. And that can be a period of time of months before people return, and can stay there really for the rest of somebody's career and make them very stiff. It's called myositis ossificans, and we don't want to see that. We want to use the muscle pump early on in the first 24 to 48 hours, so we get them going on exercises. And luckily, 2 really well-done studies that are still the hallmark studies of treating this were done at West Point, 1973 and 1991. They did it again. As soon as you can get going on flexion exercises where you're bending the knee. In fact, the second study, they said, bend the knee, wrap it with an ACE while it's bent, and put him on crutches. And with that muscle being in its chronic contracted state, it squeezes that blood out of there. So we never see these injuries if it's treated right anymore, versus if it's not treated right, it's very painful and it can harden, like I mentioned earlier. The odd part is there are two other parts of the body that we see it. And typically in tacklers in football, we will see it in the deltoid. And somebody will say, gosh, pain in the deltoid. I keep tackling, hitting people over and over again. And I have this really painful area, hard area. Can't bend the shoulder as much anymore, move it as much. And we get an X-ray, and they occasionally will harden the deltoid muscle. And then I've seen it a handful of times in a career of 30-plus years where a hit by pitch, your favorite guys, if they'll ever be able to get back out there again. I know the high school kids are getting out there, the baseball players. They get hit by a pitch in the calf, and it will actually, later on, if they don't move it and get it moving early on, it will harden also very occasionally. But the thigh is the most common one. People can miss time with this injury. And so I just wanted to talk early on about early management being range of motion, maybe even with a real deep contusion. Put them in flexion for the first day or two where you flex the knee and ace wrap them in that way, and then you will never see this injury. That squeezes that blood out of there, and they'll be playing a lot sooner. And at first when you mention it to them, they don't want you to touch it or move it, but if you immobilize it, it's absolutely the worst you can do. So we're going to use Jared Allen because we don't know about his timeline on his finger, although it doesn't sound good. We're going to use him for the quad contusion and get an opportunity to teach kids and parents and trainers and coaches about how to treat that injury.
All right, my friend. Great information and good transition. I like the work. You can see those years of radio paying off for you, my friend, with that segment right there. Job well done.
Thanks, Ray. I get to be with the best, for sure. So thank you very much, Ray.
All right, there you go. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. He joins us each Wednesday at this time.